So I know that we are rushing you in, and I should feel guilty, but I don't. And the reason because I don't feel really guilty is because we have had quite an amazing morning listening about the Ohio experience, how they went around looking at payment reform and changing the way that they deliver care, and now trying to branch out to address those other things that normally or traditionally we don't look at for in our clinical practice, and blending those worlds of population health, public health, and delivery of services. And then we look at the Million Hearts experience, where we found public health playing a completely different role than what in some cases is expected. I was part of that collaborative, and I had some internal revolt in my staff because, well, we are not about just providing the care. We are not about improving the outcomes in the doctor's office. And no, we aren't. But when we are collaborating, we need to learn somebody else's language. And that is a key step in how we build that collaboration, help build the partnership and the credibility that goes both ways, and how we can come and do that. And that is a really important part that actually goes into George's question at the end. Well, so is this what we're going to be doing? Well, this is part of what we're going to be doing, I guess. This is part of building a model that we will continue to use. So for this afternoon, we have a couple of really great things. The first one is that we have two great people here who are going to lead us in a discussion that help us to enhance a culture of collaboration to build a culture of health. And then in the afternoon, we'll have the other two sessions where we're going to look through the analysis of the asthma situation case and progress made there, and the collaboration with the healthcare delivery industry, how we can advance that. Even in the morning, we heard from a couple of different payers, the public payers, the private payers, and how we all come together. So to kick the afternoon off to really great discussion, and I feel for them because the ones that I dislike the most are the one at lunch. But we have two great people that will not let us, not let you, and not let me kind of nod off because that happens after lunch. So we have Paul Matesek. Did I mispronounce it too much?
Sounds good. Thank you.
He has been the executive director of the Wilder Research in Minnesota for more than 3 decades. He is a sociologist with deep expertise in collaboration and increasing service and organizational effectiveness. And to his right. I have some issues with laterality. We have Lloyd Michener, who is a professor and chairman of the Duke Department of Community and Family Medicine. He's the director of the Duke Center for Community Research and clinical professor in the Duke School of Nursing. He is a member of the Institute of Medicine committee that authored the Primary Care and Public Health Exploring Integration to Improve Population Health report, and he continues to disseminate and help implement this report through many different things that he does, including his partnership with ASTHO. So please take us on a really great ride for the next half an hour.